Welcome. This is Dr. Philip Nedelman bringing you For Your Health again, the program with health-related issues for the residents of Braintree. And I have two special guests with me today. Dr. Freder, would you introduce yourself, please? And
Rolf Freder, Medical Director of Medical Oncology at the Dana-Farber South Shore Cancer Center.
And Patty Lynch.
Patty Lynch, I'm one of the infusion nurses.
Okay. I might say that you both work at the Dana-Farber Cancer Institute, that is on Main Street, just across from the South Shore Hospital. Next month is the one-year anniversary, and the title of this program today is Cancer Treatment in the 21st Century, something of that effect. And I asked you before the program if you bring us up to date. Now, you're certainly not new to medical oncology, so how are things different nowadays that we have the excellence of the Dana-Farber Cancer Institute here?
Well, in terms of how things are different, I started my training at the Dana-Farber in Boston in 1988 as a fellow. And a good example is colon cancer. At that time, if you had metastatic disease outside of the colon, in the liver or the lungs, say, we could treat it with one drug, 5-FU. In the last decade, we have had 5 new drugs that we can treat metastatic colorectal cancer with, including so-called targeted agents, antibodies that are specific for various targets that help kill colon cancer cells. And so we have really a wealth of new and increasingly effective treatments. So the bottom line being, now colon cancer survival used to be 6 months to a year when it was metastatic. When it's disseminated, we've now pushed it to well beyond 2 years with our new treatments.
I see. And this applies also to other forms of cancer also, the preponderance, the increase in number of agents or types of chemotherapy you can use?
For many different cancers, yes.
All right.
Yes.
Is there some particular kind of special diseases that you care for in the Weymouth as opposed to the Boston Dana-Farber Institute?
We care for almost all cancers here, certainly all the common ones, breast, lung, colorectal, lymphoma, ovarian cancer, we would care for there. We put extra special emphasis on the breast cancer where we have second opinion clinics. And one advantage really of the Dana-Farber South Shore Hospital Cancer Center is that it promotes highly effective, cutting-edge, really research-based, so-called multidisciplinary care. The coordinated interaction between various specialists, radiation oncologists, surgeons, medical oncologists, radiologists, with very intensive care from the infusion and other nurses as well, to really attack a cancer in a very specific and highly effective, targeted manner, if you will.
So all these disciplines are under one roof.
That's the advantage here, one-stop shopping.
And is there any, do you make any distinction between, I mean, are there any patients that you might send into Boston rather than take care of in the Weymouth area?
We send patients into Boston for bone marrow transplantation, which is highly specialized. Certain extremely rare cancers such as sarcomas, which are rare nationally. And we would also send them in for clinical trials, so-called phase 1 clinical trials, when you have exhausted, when a patient has exhausted all available standard therapies with a proven track record. If he or she is still interested and they're still active, they're a candidate for these phase 1 or clinical trials of new agents, which is really where all of our currently active therapies came from.
So phase 1 trials are presently not being performed in Weymouth?
Not at present, correct.
Okay, but perhaps in the future?
Yes.
And they would be an extension of what they're doing in Boston?
Yes.
And Patty, you tell us a little bit about yourself, please. You're RN.
I'm an RN. I started out nursing about 34 years ago. I actually started out in surgical oncology, and you're right, back then you had metastatic disease and a very limited prognosis. And today, like Dr. Freder just said, you can go for like 2 years with all the new therapies that have come out.
And how do you fit in the institute? What just as your role as far as patient contact?
Nursing-wise, Dana-Farber, when the patient comes in and sees a physician, and the treatment is decided, they are assigned to a primary nurse, and we're the nurse that they see all the time for their treatments. If they have any questions when they phone into the clinic, their phone calls are directed to us, and we call them, so it's basically one-on-one with the patient at all times. And so we get to know them pretty well, they get to know us pretty well.
Now, these patients have all had their diagnosis established already.
Correct.
And they, geographically, where would you say that most of them are from? The South Shore?
Large amount from the South Shore.
South Shore, Weymouth, and down toward the
Braintree,
Cape.
oh, yeah, definitely Marshfield.
How many have been through the South Shore Hospital itself? What percentage?
We get some of them from just doctors' offices. If they notice an enlarged lymph node, and one of the ENTs or general surgeons will biopsy it, we'll get many that way. Probably, I would roughly estimate a third of our patients might come from a South Shore Hospital admission where you find an abdominal mass in the setting of abdominal pain and go from there.
So many patients are referred to your institute that live in general proximity. I see.
We go from Brockton to Plymouth, and as Patty said, on to the Cape, but we've actually had some patients from much greater distances come here.
Understood. Now, what you mentioned colorectal cancer, is that probably the more common, or breast cancer? What do you see most of?
We see a tremendous amount of breast cancer there. There are 4 divisions actually 5 divisions in the Cancer Center besides medical oncology, which Patty and I are a part of. We have radiation oncology, which is in the lower level. We have a multidisciplinary clinic, which is really under the direction of Dr. Thomas Clancy, a surgical oncologist, which is where the neurosurgeons, ENTs, and other surgical specialties practice. The 4th discipline is the imaging discipline, so CAT scan, MRI, soon a PET scan.
PET scan is coming.
Exactly, and also the 5th would be the Breast Cancer Center under the direction of Dr. Suniti Nimkar. So they are seeing approximately 1,500 new cases in the last year.
1,500 new cases.
Exactly, and so we'll take the patient through, that's another good example of multidisciplinary care where you have a surgeon involved, medical oncology, radiation oncology, and oftentimes other ancillary specialists as well.